that cervical cancer is the most common gynec malignancy detected in pregnant women. This is Dr. Alka here, Associate Consultant in Gynaecology Oncology from Max Super Speciality Hospital, Shalimar Bagh. So we are here to discuss some basic questions and answer them, the doubts regarding cervical cancer and its management during pregnancy. So cervical cancer, as I mentioned, is the most common gynec malignancy detected during pregnancy, with an incidence ranging from approximately 1 to 12 women in every 10,000 pregnancies. Now the problem is that the symptoms are fairly overlapping with those of pregnancy, but there are certain important symptoms which you have to report in case you see them during your entire duration of pregnancy. For example, heavy bleeding during any trimester, copious discharge which is not getting reduced on treatment, postcoital bleeding, abnormal pain, difficulty in passing urine or stool. So in case you develop any such problem, please report to your gynecologist, your obstetrician or your nearby gynec oncologist. So there are various techniques which can be used to diagnose cervical cancer during pregnancy, some of which are: we can do a magnetic resonance imaging, that is an MRI scan without contrast during pregnancy, as it is free of radiation and does not bear any harm to either the mother or the fetus, and also gives us enough information on the cervical cancer status. Secondly, obviously we do need a biopsy, but it has to be avoided as much as possible. So what we do is a colposcopic examination where a magnifying lens is applied to the cervix, and in case we have a doubt and the index of suspicion is very high, a biopsy can be performed. If not, then the biopsy need not be done. Other investigations like an ultrasound can also be done if required. So the mode of delivery that is preferred is a cesarean section, and there are many reasons for that. If the lesion is small and we had done a trachelectomy during the gestation, during the pregnancy, then it is very important that we remove all risks of uterine rupture or sudden hemorrhage which can occur during delivery, and the best method is to do a planned cesarean section before the patient goes into labor. The second thing is, if the patient has an obvious tumor and we had given chemo, the vaginal route can lead to bleeding, obstruction and a lot of other problems. So in such cases also, cesarean section is the preferable mode, which is safe and sound. So the data on cervical cancer passing on to the baby is not very robust, but the chances are low. But histopathological testing of the placenta can be done. If chemotherapy had been taken in the past, then there are chances that the drug may pass on through the breast milk to the baby. So please maintain a gap of at least 15 days between the last chemotherapy and breastfeeding of the child. So to conclude, I would just like to say that pregnancy is itself a roller coaster ride for the lady. Adding to that, the detection of cervical cancer may add to the emotional and physical burden. So diagnosis on the right time, the right management and counseling will have superior maternal and fetal outcomes.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.